Leader of the third party.
Thank you, Honourable Speaker. I just want to talk about what we've heard so far in this chamber on this topic. We're doing our level best. It's all of our responsibility. We're doing everything we can. There's a treatment capacity issue. It's been overcome by the increase of toxicity of drugs. And then we just heard from the Minister of Mental Health and Addictions a whole bunch of list of inputs. The report from the coroner today focused on outcomes. And the outcome is 7 people dying every day. I'm trying to think of an analogy that would make sense here. It's like houses are burning down every day, and the response is not to use fire hydrants and water hoses to put those fires out, is to say we're going to develop an entire network of fire halls and an education program and really explain to people how not to have their houses burned down. But in the meantime, the houses will continue to burn down. For 6 years, we have been in a public health emergency, and the illicit drug supply is killing more people than homicide, suicide, and car crashes combined. It's an emergency. And we talk about pathways to hope and continuum of care. The Premier indicated he hasn't read the report yet, but I hope and expect that he would have seen the first line of the press release from the coroner's office, which said, we are calling for an increase of access to a safer supply of drugs. It is the poisonous drugs that are killing people. And we dance around this by wanting to talk about continuum of care and mental health and addictions and opioid use disorder. People are dying every day because of poisonous drugs. And there is a solution that has been put in front of this government over and over and over again. Will the Premier commit to what the coroner is asking and create immediate access to a safer supply of drugs?
Minister.
Mr. Speaker, the answer is yes. British Columbia is the first and only province in Canada where you can get prescribed safe supply, which is the tool that a province has within a federal framework. That work began in 2020. It was expanded and revised based on what we heard from clinicians and people who use drugs, that they needed more kinds of drugs and more access points. We worked extremely hard across all partners, health authorities, people who use drugs, clinicians, paramedics, NGOs working on the front line. Last summer, I stood with Bonnie Henry and we announced the rollout of a second phase of prescribed safe supply. We've added new medications to that. We're working with prescribers, with the colleges every day. We've directed the health authorities to implement it across all programs. We need to do more clearly and obviously because the interventions we've made have been outpaced by the increased toxicity of drugs. But we are hitting this across the continuum. More treatment beds, more types of overdose prevention sites. We went from 1 to 40 over the term of our government. We are connecting people with medication-assisted treatment, with prescribed safe supply, because that's what we can do, and we're determined to do more at every, in every form, because this is an emergency that requires we bring all tools to it, and that's what we're doing, offering people options, and we're determined to do more. We have to do more.
Leader of the third party, supplemental.
I'll note, Honourable Speaker, that the Minister used prescribed safe supply, which is not what is being called for in the coroner's report. The prescribed safe supply isn't working because more people are dying. That is the measure. That is the measure that we should be looking at, Honourable Speaker, is what is being done succeeding in having fewer people die? And the answer year over year is no, it is not. And to stand up and say, we're just going to keep doing the same things and expect different outcomes is becoming deeply distressing. The current drug policy framework is rooted in prohibition, criminalization, and marginalization. And these policies fail to afford basic dignity to people who use drugs by forcing them to access a chaotic, poisonous, unregulated supply that is killing them. And the government's alternative is treatment beds, get clean, get fixed. This actually adds to the stigma that makes this more deadly. We can freely purchase drugs, all of us. We can go to the liquor store and purchase drugs. We can buy nicotine, we can buy cannabis, we can buy over-the-counter medication. Those are all regulated. I can be assured that when I get a bottle of Advil, if I take the appropriate dose, it is going to relieve pain and not kill me.
Question, member?
My question, Honourable Speaker, is again to the Premier. Why does his government lack the political will to introduce non-medicalized safe supply?
Minister.
Mr. Speaker, we do not lack the political will, we lack the jurisdiction. That is a federal matter, and we are doing everything we can with urgency within our provincial authority. I feel the same urgency that the coroner feels and that the death review panel feels. Absolutely. And we know there's more to be done. The terrible loss of life is testament to that. But we have continued to evolve our response. To say that this is a single push, the member knows that we are not advocating for treatment only. At the start of the public health emergency, we focused on scaling up overdose prevention. More teams, more naloxone, more overdose prevention sites, building health authority capacity. Then we added in medication-assisted treatment. Then later, we gave the permission, the only place in Canada, to allow nurses to prescribe medication-assisted treatment. We added in low-barrier tie-out programs. We then complemented that by scaling up overdose response, community outreach teams, community-driven programs. We added in inhalation overdose prevention sites. Then we pushed the envelope again with nurse prescribing, then even further with prescribed safe supply. And we're the only province in the country to apply for decriminalization of people who use drugs. And none of this has been enough. And so we continue to do more, and we'll continue to add more tools as they are recommended within our area of provincial authority. And I'm so encouraged that I now have a federal counterpart, that the Prime Minister has mirrored what the Premier did in establishing a dedicated Minister of Mental Health and Addictions, and I'll look to my federal counterpart to look at federal tools on safe supply.